Would you murder someone you didn't know? Someone who could not defend themselves? Hello everyone, my name is Cassandra Spalding and today I'm going to talk to you about abortion. I have spent the last 3 weeks researching information on the topic abortion, and I hope you enjoyed this presentation today. Viewer discretion is advised, as the pictures and information you are about to hear and receive are graphical. I hope you will learn about abortion through my speech and the many different types they have. Main points of speech are as follows: different types of abortion, how abortion is performed, how long it takes to recover from abortion, how many weeks old can the fetus be and you still have an abortion. My information came from the following sources: PlannedParenthood.com, AbortionProcedures.com, Women'sHealthWestVirginia.org. The definition of abortion is the deliberate termination of pregnancy. Abortion used to only be legal before the embryo or fetus was capable of independent life. Now, some states have deemed it okay for an abortion to happen straight up to the day you are about to deliver. Abortions are viewed differently across the world. Usually, abortion happens in the first 24 weeks of pregnancy. It is certainly true that there are very different types of abortion. One type of abortion, which must be carried out within the first 9 weeks, is called the early medical abortion. This is performed by taking 2 different medicines 24 hours apart. The first pill is designed to cut off progesterone, which stops blood flow to the child and oxygen, and the fetus then dies inside the mother's womb. However, this step can be reversed if the doctor administrates progesterone to the mother. The second pill is designed to make the mother's uterus contract, and the mother will then begin to cramp and bleed. The bleeding is necessary to push the baby out of the womb. Another type of abortion is called the suction abortion. A suction abortion is carried out if a woman is between 7 and 15 weeks pregnant. That involves the fetus being sucked out of the womb. It takes around 10 to 15 minutes and can be slightly painful and very uncomfortable. During this procedure, the medical physician will use dilators to dilate the mother's cervix. Once the mother is dilated and the physician can see the uterus, the physician will use a suction to suck the baby out of the mother's womb. Once this step is completed, the physician will use a purette, which is a long skinny knife, to scrape the uterus and get out any remaining pieces of the baby that the suction left behind, which is often the baby's head. In this picture right here, you have the medicine that is used for the medical abortion. This picture is the different steps to the suction abortion. Dilation and evacuation is an abortion procedure that is used in the second trimester, usually between 13 and 24 weeks. Before the abortion begins, the doctor must insert a laminar 24 to 48 hours before the abortion can be done. This is done to absorb amniotic fluid. The doctors administer anesthesia. And once the mother is asleep, the doctors use a weighted speculum. This is used to open the mother's vagina so that the doctor can see the cervix. Once these steps are completed, it is time to remove the laminar that was previously placed before the procedure. Now metal dilators are used to finish opening the cervix. Next, a suction tube is placed inside the cervix to drain the rest of the amniotic fluid. Because the baby is so big as gestational age, the suction tube is not strong enough or wide enough for the baby to be sucked out. Example of how big the baby is during this abortion is your hand. 7 inches without counting the baby's legs. This abortion is being done. The baby's arms, not counting the baby's legs. Now that the baby has no water around its, a sulfur clamp is used to rip the baby's arms and legs off of its body. A sulfur clamp is then used to crush the baby's skull. The doctor knows he has made it to the baby's skull when a white matter comes out. That is the baby's brain. The doctor then uses a Perrette to scrape any remains that may have been left behind. Once the doctor has done all of this, he places the child back together to make sure he has a whole child. Induction abortion is another type of abortion that is done in the third trimester, 25 weeks to birth. This means that the baby could survive outside the womb of the mother if she was to go into premature labor. This procedure takes 3 to 4 days to complete. Because the baby is so big, on day 1 the doctor injects dioxin into the baby through the mother's stomach. He aims for its head or its heart. Dioxin is used usually to fix heart problems, but at a strong enough dose it is lethal. The baby feels. The baby does feel pain at this stage. This kills that child. When the baby is born, it will be stillborn. Now the doctor will insert multiple sticks of luminar, also known as seaweed, into the mother's cervix to dilate it. On day 2, the doctor performs an ultrasound to make sure the baby is dead. If the baby is not dead, the doctor does a second dose of dioxin. Now the baby is for sure dead. The mother packs around this child for 2 to 3 more days until she goes into labor with her dead son or daughter. Late-term abortion can have different meanings. Most say they are in the third trimester when the fetus is viable, meaning the fetus could survive outside the womb. And there is emergency contraception type of abortions, known as the morning after pill. Taking this pill within 5 days of having an unprotected sex can prevent you from having a baby. Late-term abortion between 27 and 39 weeks is where the baby is cut apart and removed surgically, and is referred to as dismemberment abortions, as well as intact dilation and extraction, partial birth abortion. Abortion is one of the most common procedures performed in the United States each year. Though many countries it is illegal to have abortions, there is 26 countries where abortions is illegal no matter what the circumstances are, and 37 countries it is illegal unless the abortion would save the mother's life. More than 40% of all women will end a pregnancy by an abortion at some point in their life. Women from all social walks of life seek abortion, but it is typically women who are young, black, unmarried, poor, or over the age of 40. The United States counts legalized Roe v. Wade decision, and about 1.2 million abortions are performed each year in the United States. Abortion is one of the most controversial areas in the field of medicine, as when does life begin? My question is, do you consider abortion murder or a woman's right? Again, I can't do it to stop it.